Hi, my name is Kate Sandusky and I suffer from borderline personality disorder and depression. Borderline personality disorder for me, how it affected me is a wave of emotions that's up and down, and basically you're very insecure about yourself, you have anger issues, you are very unstable basically. And depression, it's just, you feel hopeless and you don't know where to go.
I've been a priest for 31 years, but I've suffered from depression since I was 12 years old and been through many doctors, medications and things like that. And it was always a taboo. You don't talk about it. Something's wrong with you, and it's kind of an embarrassment. But I think in the world today, we're having a better understanding of mental illness, depression, anxiety, and it should become something that nobody has a fear to talk about, especially with the people they love the most. And we need to get rid of that, just the way in which the world looks at it today, because I think the majority of people I experience in my own ministry suffer in one way or another.
I started having depression, diagnosed freshman year of high school, but borderline personality disorder I had all throughout my life and was diagnosed at 16.
I'd say the majority of the time what ends up happening is that I glean their symptoms to be associated with depression or anxiety. So for instance, sometimes I'll get patients coming in with abdominal pain, chest pain, difficulty breathing, palpitations, and from a good history I can make the differentiation of whether the patient's anxious or depressed, and then as such ask more questions that then help me determine what form of depression, how severe the depression is.
In the classroom, your mind really drifts. You don't pay attention. You zone out. You're just staring straight ahead, just feeling this weight on your shoulders, and it's not very easy to get good grades or focus. Everything around you is just a blur.
There has been a progression of depression and anxiety among high school students. One reason for this is that there's more awareness. We're better at identifying the needs of our students. Other reasons have to do with family dynamics, community violence, also socioeconomic status and social media.
Another area that's of great concern nowadays is social media, and I think for parents in particular it's important to keep close tabs on what their children are doing online. There's a variety of tools that are online where parents can actually monitor online activity of their children. There's a lot of bullying that goes on. There's a lot of sexual abuse cases that go through the internet and social media that parents could do a great job in trying to monitor and make sure that doesn't affect their significant other or family member.
When you have a friend that comes and talks to you and says, I'm depressed, or I'm suicidal, or I don't want to live, it's never a joking matter. And it's always something that you need to get help, and never be afraid to get other help, to reach out to other people and say, hey, I need some help. Because when a person is in that dark place, sometimes they don't have any feeling, they're numb. And when they're sharing it with you, what they're really saying is, I need some help.
Therapy helps a lot, I would say, because you get to get your feelings out and get help, and to let them recommend things to help you not feel so down all the time, and just having someone to listen to you and to make you feel like you're normal and you're not some crazy person, which is sometimes what I feel like, and others probably feel like it because they're not used to this feeling.
Very few teenagers want to think they're different from other kids, and if they think, hey, I have this thing called depression, wow, that's mental illness, that means I'm crazy. I don't want to stick out and make all my friends talk to me behind my back on Instagram or something. And I should just keep it secret. So a lot of time adults should take a primary role in taking care of the teenagers.
I knew it was good to reach out to a therapist. That was the first step. And when you go to a therapist, they really assess you, and if it's very extreme, they send you to a psychiatrist. And those things have helped me, and I'm sure they'll help other people.
My initial visit, if it's a mild to moderate depression, I'll usually just recommend cognitive behavioral therapy or counseling. Exercise feels very helpful for neurotransmitters to be at their optimal levels. Journaling every night, that's also very helpful. Yoga has also been shown to be very helpful. And then medications, that's for more moderate to severe cases where we treat patients with antidepressants.
The ways I cope are singing, drawing, or any physical activity to get my mind off of it.
So coping has to do with our ability to manage stress. We all cope in different ways. Sometimes we cope in unhealthy ways. A lot of teenagers will tend to use drugs or alcohol to cope. So really when we're talking about managing stress, we want to look at creativity. So what do we like to do? And maybe we want to start doing new hobbies, but maybe we want to start with simple things. So for example, when it comes to anxiety, an anxious mind cannot live in a relaxed body. So maybe we just want to take a hot bath, a shower, stretch, do yoga, go for a run. Other ways of coping can be coloring, talking to somebody. When it comes to feelings of depression, maybe we want to start to just do something different. Maybe try something new. So what would we be doing if we weren't depressed? And maybe setting some short-term goals and see how we respond to that. But a great way to cope is really start talking to somebody.
If you are feeling very depressed, especially if you're doing things to injure yourself, cutting, scratching, burning, or if you are drinking alcohol, using drugs, trying to mask your feelings, there's a wide variety of help available.
If a student feels that maybe they need some help, they should start with a trusting adult on campus. It could really start with a security person, a secretary. High schools are becoming better at helping our students, and we're all talking to each other about the ways that we can help students. So find your trusting adult, the person that you feel most comfortable with, and if they're not sure what to do, then I would start with a school counselor. All the school counselors are aware of the resources on campus for students.
If you're by yourself at home as a teenager and you feel a little desperate, there's National Suicide Hotline, and of course you can tell your parents and take you to an evaluation that's available 24/7, either to the local emergency room. Of course, the Bakersfield Behavioral Hospital, we're open 24/7. We'll do assessment and we'll refer people around the clock. And Kern County Mental Health has a crisis unit at Mary Kay Shell, and it's separate from adults. So you will be in a very private area for minors only, and they do a very excellent job too.
You can always call the 24-hour crisis hotline. That's 1-800-991-5272. You can also use the teen to text line. That's 741-741.
Don't be afraid to be honest about how you feel, because you are not the only one that feels that way.
Follow up with your primary care doctor and discuss your concerns, because we're always there to help.
Reach out, talk to someone, because it's okay not to be okay. You don't have to be perfect all the time, because we're human and we're not made to be perfect. So just reach out to somebody, because if you're suffering, it's okay to speak out.
Sometimes it feels like nobody cares and it's never going to change. Know that things will pass and that there is somebody there to help you.